Welcome to the Checkup. I'm Modern Healthcare's managing editor, Erica Teichert. The healthcare industry often lures non-traditional players who hope to cut costs, improve delivery, or otherwise disrupt the status quo. That includes major consumer retail chains like Walmart, which have an opportunity to alter how both their employees and their customers access primary care or even COVID vaccines during the pandemic. Walmart's strategy has taken different shapes, from launching primary care clinics to using community partnerships to focus on healthcare in underserved communities and tech-focused partnerships to scale innovation. Joining me to discuss Walmart's strategy is Dr. Cheryl Pegus, Executive Vice President of Health and Wellness. Welcome to the Checkup, Cheryl.
Great to be with you today. Thank you for having me.
Thank you. Healthcare was Walmart's fastest growing business sector last quarter. What do you see as the company's big healthcare wins lately?
I'd say the things that we are very much focused on is how people utilize healthcare. So people very much, there are days when they are leaving their home and going into an office. We provide solutions for that. We're growing that business. As many of you are aware, we're opening clinics in Florida this year and adding additional clinics in Arkansas where we already have a presence. So we want people, when they want to go in to see someone, be it on a Saturday or Sunday, to be able to have in-person care by our clinical team. The second piece of that is people are not just looking to see primary care, but for many people, they need dental care and optical care. Sometimes they need help in understanding their health benefits, and we provide optical and dental care within the same primary care site. And we have community health workers to help people understand their health benefits or help them with any other health challenges. So that one single source and place to get all of your healthcare needs is what we have in person. There are people, however, who'd like to receive their care virtually. I'm one of those people. And what I'm looking for is, again, that easy access. Where Walmart today is only in a number of states as we continue to expand that business, our telehealth business that we acquired last year, which is now called Walmart Health Virtual, is national. And we're able to provide virtual healthcare across the country to anyone. And that is not just acute care. Actually, our virtual health company that we acquired were the first ones to do virtual primary care in the country. And we've now continued to expand that. And so that's available, as well as behavioral health. And we have that national as well. In our telehealth offerings, we not only include virtual health for adults, but we were the first to launch a program specifically for teens, recognizing the needs of that population. We also have a virtual COVID-19 program where you can see someone for your symptoms. You can be prescribed medications, and then you can have it filled at one of our pharmacies, where our pharmacy is able to get in the information and provide you real time. In some of our geographic locations, we actually will also deliver that to you, to your home, same day. So really attempting to allow people to get healthcare the way they need it without disrupting the rest of their life.
How has the adoption been for that, both for the primary care clinics and telehealth?
And so adoption has been pretty amazing. I will tell you, for our clinics and some of our sites, we've seen growth of 80% year over year. We've also seen NPS scores somewhere in the 80s, which is pretty incredible for us as an organization. And we're also seeing people lining up for specific services where even if they've seen their clinician in person for their follow-up visit, they'd like that to be virtual because it's a blood pressure check, or it's to see how they're doing with their medications. We have integrated our virtual health into our clinics. We did that last November. And so we're seeing that also be a way for people to access care through us. I mentioned our NPS score in our clinic. And I'd say in our pharmacies, which is another great place for everyone who's received a COVID vaccine this year, our NPS scores are somewhere around 75 to 78 in our pharmacies. So we're very focused on consumers not only having a great experience, but in ensuring that we're providing value and improving healthcare outcomes.
And obviously, Walmart is a huge employer as well. Are there any differences in your strategy for as an employer versus for the customers that come through Walmart stores?
It's a really great question. I always remind people that for our Walmart pharmacies and our Walmart clinics, our greatest users are actually our associates. We have 1.6 million in the US. And what we hear and the feedback from them of what they'd like of the healthcare services that we provide is actually our greatest motivation for our innovation, because these people in our stores, our associates, actually live in these communities. And so they know what their own healthcare and their own family's healthcare needs are. And that really drives us in being able to provide solutions that they can use. When I say that we have a new COVID-19 telehealth offering, it's because of what our associates need. They want to do symptom checking. They want to see a physician if they need to. They'd like education about the new oral treatments. They'd like to understand if they need a booster. And so we've really encapsulated what they need. Knowing what they need allows us to personalize it to the communities. We're very focused on not having here's a Walmart solution for the US. Our solutions are actually community by community. And so what works in Alabama may not work in Nevada. And so we're very much aligned with how do people access healthcare? Are there people who want to come into a store? Are there people who'd rather do a drive-through? If they're picking up their medications, would they rather have that curbside? And really tailoring it community by community and giving our frontline associates the autonomy for them to own how people achieve their best healthcare based on how we provide those solutions. So that's something for us that we continue to roll out. We learned a lot of that during COVID, of how it matters community by community, and we're continuing that with all of our additional healthcare solution offerings.
And I know that you've been focusing a lot on those community partnerships and trying to treat each community individually. Could you talk a little bit more about some of those partnerships or how those have come about?
Absolutely. And so I think I talk a lot about what good health looks like, and that for good health, it has only a small portion to do with your physician interaction. If good health is 100%, that physician-patient interaction is only 20%. 40% is social determinants of health. 30% is personal behaviors. 20% is when you see a clinician. And then there's 10% that's environmental, that frankly, we all in healthcare have a lot to do to make sure we address the genetic and environmental changes. What we're trying to do is say, if 30% of your care is personal behaviors, which means can you go home when you're not in a doctor's office and care for your diabetes? Can you go home and understand your hypertension and your medications? Do you understand your food and diets? To do that, you need someone in the community that allows you to feel supported and allows you to be successful. And so we've partnered with, in Chicago, again, healthcare is local, with an organization called Habit New, where our community health workers, and we have community health workers at all of our clinics, allow our patients who come in to be asked not just about the clinical needs from the physician, but what do you need to be successful in managing your diabetes? Habit New allows you to learn in a culturally and health literate manner about your own personal diets, about how to afford medications, about the things that you may be interested in understanding your weight and what physical activity you have to do. It's a program that we started last year, even during COVID. We've seen some really significant success with a retention rate in the 80% of people who have joined the program, and really speaks to, again, yes, everyone needs to have a physician because we all need to know our numbers. We all, if we have an emergency in healthcare, need to be able to reach out to someone we trust so we get access to healthcare. But the management of any chronic condition requires you to be doing things in your community. And Habit New is one of the examples that we've done. We've also partnered on HIV/AIDS with the Elton John AIDS Foundation. We're particularly focused on areas that do not today have a lot of great access, be it for testing or for understanding early treatment. And we've run some programs in Atlanta, Georgia in particular, where we've allowed for our pharmacist and testing to occur even in our parking lots. And we've brought in multiple partners. So there are partners in helping you understand the risk factors. And then if you are found to be positive, how do you receive care? We've partnered with the health systems in those communities to make sure that it is a warm transfer so that people are getting everything that they need in one location. Our goal is to partner and facilitate. For the services that we do, we want to be an omni-channel accessible site, but we truly want to make sure we're partnering so that people are getting the right care when they need it with what they have in their community.
And last year, Walmart said that it may slow its primary care clinic rollout. What's the latest with that plan?
And so we actually are not slowing it. We're doing it tailored to communities. And so the acquisition of a national telehealth partner really allowed us to now look at what does a combination of telehealth and in-person health look like. And so if you're in New York City, you're much more likely to utilize telehealth. If you're in a rural part of the country, you're much more likely to want an in-person because you're also doing all of your shopping at the same time. So what we're doing really is being very strategic to the point you made. We try to tailor our offerings to communities, and that's what we're doing. This year already, we've got 4 sites opening in Florida, which is a new location for us. We've got a number of other sites coming online. And so it's really, how do people want to access care? And are we making sure that we have that? But the addition of a national telehealth organization that provides virtual primary care has allowed us to not say we've got one approach, but really saying we've got a tailored approach, geography by geography. And that's really what we're doing in hopefully a very strategic manner.
And I imagine having that kind of approach that's focused on each individual community provides its own challenges for Walmart. Could you tell me a bit about the challenges that you're facing in rolling out that strategy?
Sure. So I think the first piece is stepping back and not thinking we know the answers for the communities. It's asking the communities what they need. There's a report that we just put out on COVID, just about what we did in the past year. And what's really telling about that is that there are parts of the country where people would say there's vaccine hesitancy. How can we ensure that that community will utilize services? We were able to demonstrate that by partnering with leaders in the community, be it aldermen, be it health systems, be it NASCAR, that we're able to tailor our offerings to a community. And so that approach of first starting out by listening to how consumers in a community will engage in healthcare is a starting point for us, as opposed to we're just rolling out clinics. So we first ask, what are your healthcare needs? How do you want to receive healthcare? And there are communities that prefer virtual and telehealth versus coming in. Sometimes it's the travel that's an issue for someone. So that's the first thing that we're asking. The second thing that we know is that cost for people is a really big driver. You're probably aware that last year we launched our own Walmart branded insulin from Relion, which is 78% less expensive than what's in the market today. So we're also tailoring our offerings to what people are looking for from a cost perspective. And yes, that's challenging, but I will tell you that's challenging from a healthcare lens, not from a Walmart lens, because every Walmart, there are 5,100 Walmart sites, every Walmart site already utilizes that types of data to tailor the offerings within each Walmart neighborhood market or supercenter. So frankly, we in the health and wellness division of Walmart are benefiting from that approach in assuring that we are tailoring what our offerings are to those communities. And so that's a learning. I think I come purely from healthcare, not from the making sure that the consumer can utilize your services. We're now able to blend that in to our rollout of all of our offerings.
And that segues right into my last question for you. As a practicing physician and your background as a cardiologist, how has that helped you as you shape Walmart's healthcare business?
So I come at this, frankly, with a ton of humility. Healthcare is incredibly complicated. And where we are in healthcare today is not in having great treatments. It's not at having evidence-based medicine. It's understanding how do we engage consumers. So I come from a place where I know a lot about what good and great healthcare should look like. And based on the quadruple aim, what I think a Walmart allows us all to do is understand, why do consumers follow medical guidelines, and then why do they not? And what are the things we need to do to personalize that? So consumer engagement is a huge part of healthcare. It is a gap for us in healthcare, and we're learning about it. We talk about consumerism and listening to the consumer more. What I'm learning at Walmart is how to run quickly with what Walmart has already learned and bringing that into the healthcare offerings that we have. So win-win.
That's great. Well, thank you so much for joining me, Cheryl.
Thank you for having me. Appreciate it.
Of course. And thank you for watching The Checkup.